Welcome to the Every Mom is an Athlete podcast, where we believe that motherhood is inherently athletic. I see you lifting car seats, chasing toddlers, and carrying groceries one-handed while holding a baby and a coffee. Your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, entrepreneur, and mom of 3. Here you'll find solo episodes and real conversations with other moms and leading experts, so you can live your strongest, healthiest, most aligned life in motherhood. No matter how long it's been since you've had your baby, whether you're reconnecting with your body, rebuilding your strength, or just figuring out what feels good again, you're in the right place. Hello, and welcome back to Every Mom is an Athlete. Today we are talking about something that I hear about a lot in my practice and also online from you guys, and that is low back pain and sciatica during pregnancy and also in postpartum. So even if you're not pregnant, I still recommend listening to this episode. I think there's going to be a lot of helpful information for you today. So what I always tell my patients in my office is that even though low back pain is common, that doesn't mean it's normal, okay? And I want to expand on that a little bit. So when you go into your doctor, let's say you go into your midwife or your OB or even just your regular doctor if you're not pregnant, and you say, my back hurts, that needs to be addressed, okay? We don't deserve to be gaslit by our doctors, which happens a lot during pregnancy. I hear it all the time. They go to their OB, they say, my back hurts, and they go, well, that's just part of pregnancy. And I'm here to tell you that's not necessarily part of pregnancy. Yes, it's common. That doesn't mean it's normal. And there are things that can be done. So I really believe that doctors, midwives owe it to you as the patient. Maybe they don't have the answers for you right then, but they can ask you some questions about it. First of all, make sure that nothing more serious is going on. And then they can refer you. They can have good referrals to physical therapists, chiropractors, massage therapists. All of those are great options as a place to start with your back pain. So I just say that to encourage you. If you are having back pain, if you are having issues, talk to your doctor about it and press them for some answers or for a referral. Let me get off my soapbox and talk a little bit more about back pain, especially during pregnancy. Let's start there. Obviously, during pregnancy, there's a lot of changes going on. So as your belly is growing, as you're gaining weight, it's going to change the way that your body moves. It's going to cause compensations, making your low back work harder. It's also going to tuck your pelvis underneath a little bit. And so that actually makes it harder to engage your glutes, activate your core. And so all these things sort of play off of each other. If you've ever heard someone or if you've experienced having a super flat butt during pregnancy or even after your baby is born, you hear that a lot. Like, the baby ate my butt. There's a couple things going on there. One, it's a postural change. So the pelvis kind of gets tucked under. We're not able to engage those glutes as much, so we're not using them as much. Generally, we're not as active during pregnancy as maybe we were before. That's a generalization, of course. But the other thing that happens is the baby actually does, we use that fat to feed the baby. So that's a topic for another episode, but just know that that is a real thing. It really does happen. And that can be one of the causes for your low back pain. The way that our body sort of works, I want you to think about it think about kind of a joint by joint. So we start at the ankle, it's super mobile, right? It moves all around. We go to the knee, sort of just a hinge, right? Moves back and forth. We go to the hip, super mobile. It's like a ball and socket. So it moves in all kinds of directions. Low back is stable. Upper back is mobile. Okay, your ribs are there, your lungs, your upper back is supposed to move a lot. Neck is stable. So as we think about that, if one of those areas is compensating for the other, then that's going to cause changes. So let's say, for example, you're pregnant, your body has gained weight, you're moving differently, your hips are much tighter, let's say. What that's going to do is now your hip, which is supposed to be super mobile, is tighter. It's not as mobile. Your low back, or sometimes your knee, the joint above and below, are going to compensate for that. That's just how we're made to be able to function and do all the things that we want to do, right? So lots of times that's what I see. The hips get super tight. The low back, which is supposed to be super stable, compensates and starts moving a little bit too much. And it can only do that for so long before it kind of gives out. And then that's when I see people in my office saying their back gave out or spasmed or locked up or whatever it is, but they're having issues now there. We look down into the hips, and that's where we see sort of the root of the problem is. And this is all the time, right? This isn't just in pregnancy, but it is more accentuated during pregnancy. Then we also want to think about all the hormones during pregnancy, right? We have relaxin, which is the hormone that loosens all the ligaments in our body. And remember, that doesn't spot pick your pelvis. It loosens all the joints. in the body. So your knees, your hips, your ankles, your shoulders, everything is going to be a little bit more lax because that relaxin is working on the joints. Also, and one thing most people don't know is that relaxin levels are actually highest in the first trimester. So sometimes even before you know that you're pregnant, it's already working on the joints of your body. So just keep that in mind. Now, let's talk about sciatica for a minute. So, I see sciatica a lot during pregnancy, and there's a couple reasons for it. So, number one, again, your pelvis is shifting. Imagine if one of your hips is sort of rotated forward and one is sort of rotated back, they move individually. Or if we're thinking about at the pelvis, it moves individually. That can put a lot more pressure on one side, and that can cause those glute muscles to sort of clamp down on your sciatic nerve. The sciatic nerve, just in case you don't know, is the nerve that comes from the little nerve roots come out in your back, and then they go down, they form into the sciatic nerve, which is the longest nerve in the lower body. And it goes all the way from your back, through your glutes, through your hamstrings, down into your calf, into your foot. So longest nerve. And we'll talk a little bit more later about sciatica and like other ways that we can have it because there are a little bit more serious issues. But right now, let's just talk about it as it's pain shooting down the leg. Occasionally can be kind of tingly or numb, sometimes weak. I will say if you're experiencing numbness, tingling, weakness, that is a reason to talk to your provider. Make sure that they know that this is going on. Make sure that you get a referral to someone if you need it, especially if you're having weakness, okay? Like if your foot is not like staying up when you kind of pick it up, that's called drop foot. If you're having more serious symptoms like that, rather than just sort of like pain in your glute or your back, or maybe even a little bit into the hamstring, make sure you talk to your doctor about this. All right, so let's get into some of the mistakes that I see when people have low back pain or sciatica during pregnancy or not. So the first thing is they try to stretch it. So lots of people, they want to stretch out their hamstrings, okay? What this does is it can put more pressure in your low back. And if the issue is coming from your low back, where the sciatic nerve originates, then that is going to make it worse, okay? So this is what I see a lot. People bending forward, kind of doing that hamstring stretch. Do not do that, all right? You can stretch your hamstrings, that's fine, but you want to do it on an elevated surface. So think you're standing up straight. You're going to pick up your leg and put it on a couch in front of you. Stretch it that way, keeping your back nice and flat rather than rounding forward and stretching it, okay? It's just more protective for your low back. I want to pause for just a second and talk about something that I know a lot of you are dealing with. If you're experiencing hip pain, sciatica, round ligament pain, pubic bone pain, or deep pelvic discomfort, whether you're pregnant or newly postpartum, it is not something you have to live with. I created the Fix Your Hip and Pelvic Pain Plan to give you a simple, effective way to relieve pressure, improve alignment, and move through your day with less discomfort. One mom who used it told me that she started the hip reset with her husband every night at the end of her last trimester, and it was the only thing that helped her sleep. Even after her home birth, she said most of the pain was gone in her hips and low back. This plan includes exactly what I use with my in-office patients, but it's designed for you to do at home. If your body's been asking for relief, this is your sign. You can grab the plan now in the link below. Back to the episode. The other thing I see people doing is nothing, right? Is just living with it and accepting it as part of pregnancy. And that is really where I want you to know and feel empowered that you do not have to accept it. There are answers. There's lots of stuff we can do. And I'm going to go over that in a few minutes. But just know that if you're having these issues, reach out to someone like me, to your doctor, and find a way to work through it because oftentimes there are some really simple things that you can do that will make it better. So, number one thing that I recommend when people come into my office with low back pain during pregnancy. So, let's get away from sciatica for a minute. Let's talk about low back pain. You come in, you're, let's say, 28 weeks pregnant, and you're like, Karlie, my low back is killing me. Maybe it's one side, maybe it's both sides. Either way, I'm going to take you through a full evaluation, see how your hips are moving, do some orthopedic tests on you just to make sure nothing more serious is going on. But then what we're going to do is we're going to actually go out into the gym space in my office, and we are going to work on some strengthening and some mobility. So, number one thing I have almost every pregnant woman in my office do is some low back strengthening. And this can look very different. Early on in your pregnancy, you can start with some Supermans on the floor, some good mornings where you have the barbell on your back and you're sort of flexing forward, keeping your back nice and flat. But as you get farther along in pregnancy, you're not able to get on the floor and lay on your tummy, right? So if you have a GHD, like if you're in a CrossFit gym and you have a GHD, sometimes they're called a Roman chair or an extension bench. I like the ones that are flat so that you bring your feet up and you're sort of like horizontal to the floor. But sometimes gyms, if you go to like LA Fitness or 24 Hour or whatever, sometimes they have the ones that are at an angle, and those are better than nothing, okay? So if you have one of those at your gym, what you want to do is get up on there and hold yourself up in that position. And what you'll feel is your low back muscles are working, your glutes, your hamstring, that whole kind of posterior chain. And that's okay. It's all connected. But really, this is one of the only ways that I have found to get those low back muscles to fire and work. So I start my patients off, we get them up there, we see like, okay, can you hold 20, 30 seconds? Then we're going to do that a few sets, maybe 3 or 4 sets. Okay. And what I see very often is my patients get off of that bench and they feel better. I would say honestly, 90% of the time during pregnancy, because what's happening is those muscles are engaging and they're stabilizing the pelvis. So remember, the pelvis is more unstable, the ligaments are all kind of lax. So by engaging those muscles that attach right into your low back, you're going to stabilize it and it's going to make you feel much better. It's going to decrease the pain. So sometimes it's a little counterintuitive, like, wait, you want me to use the muscles to make them feel better? Yes, that's exactly what I want you to do. The other thing we do is some mobility. So I find again that many people, pregnant or not, have tight inner thigh muscles. So we foam roll those. That's one place to start. I also have people do like a figure 4 with their legs and then sit on the foam roller and roll the glutes, because that can kind of open up some of the glute muscles and give that sciatic nerve a little more space in there, and maybe it won't cause so much irritation. So those are a couple things that we want to mobilize, and we want to strengthen the low back. So without knowing, exactly what's going on, if you had to say, Karlie, what would you do if someone had low back pain during pregnancy? Those would be my starters for sure. Other things I would do is, if you came to see me, obviously I would adjust you, and I use Webster technique. And that's just a really gentle chiropractic technique that I recommend for all my pregnant patients and even my early postpartum patients, to find a chiropractor that does that specific technique. You can literally just Google Webster technique chiropractic in your area and see who pops up. And they'll generally be someone who's also much more skilled and advanced in pregnancy and postpartum care, just because that is the sort of work that people who do Webster do. So it's just a lot more gentle. We don't have to twist you up and crack and pop things. It's a very gentle mobilization to get the hips moving evenly, and also to help create optimal room in your pelvis for that baby to get into a good position. Because you can imagine if one of those hips is really like rotated forward and one is rotated back, then that baby might be sort of in kind of a oblique position and not able to get into a really good head down position. I also work with all of my patients on breath work. It was so funny. The other day, I actually had a patient in and she was having some rib pain, and we just had her start doing some breathing. We call it 360 breathing. So where you're breathing all the way around, into your belly, but all the way kind of letting your ribs expand out too. And it really, after a few breaths, started to decrease her pain. And she was like, wow, I can't believe that like breathing is just like taking an Advil. And I was like, man, I need to like make a t-shirt that says that or something, because it is true, especially during pregnancy. If you're having pain in your low back and your ribs, one thing that can be happening is that diaphragm, your breathing muscle, which is underneath your ribs, kind of gets crunched up. And if it's not expanding, it can cause other issues throughout your core and even down into the pelvis and low back. So I always make sure we do some breathing. That's also just going to kind of calm down our whole nervous system, which, let's be honest, most of us need anyways, but especially during pregnancy. And then we want to look at like simple daily things, okay? So people always want to ask me like, oh, what can I do in the gym that'll make this better? But like, you're in the gym, maybe an hour a day? And you have to look at the rest of your life to see what are you doing that's causing this, right? During pregnancy, sometimes it's really truly is just the changes in your body, the hormones. But are there other things that you're doing? Are you using a pregnancy pillow so that you're getting support at night, for your belly, a pillow between the knees to support your hips? Are you sitting with your legs crossed a lot? Because that will totally throw off your pelvis and your hip alignment, pregnant or not, but obviously easier when you're pregnant. Okay, again, just because things move easier. Are you walking? Are you doing mobility work? All these different things are factors. Do you have a toddler? Are you holding them on one hip, sort of jutted out to the side? All these things can play a role. And so we want to look at all those things and then make some modifications where we can. Maybe we're trying to hold the toddler on the other side. Maybe I'm not using my pregnancy pillow properly. Let me make sure that it is between my knees and it is supporting me. All these kind of things. We can look at that and make some modifications there before we start looking at okay, what can I do in the gym? All right, quick note again about sciatica. As I mentioned, if you're having that sharp shooting pain, if it goes all the way down your leg, especially past your hamstring, if you're having numbness or if you're having that foot drop where you just can't pick up your foot, that's when you want to check with your provider, okay? That's where something a little more serious, potentially in the low back with your discs, which is that little cushiony part between each vertebrae. Okay, something could be going on there. So you want to check with your provider, especially if you're having those more severe symptoms. All right, I hope that helps. I just want to make sure that you know that if you're having low back pain, if you're having sciatica, that you are not alone. It is very common, but it's not normal. It's actually the whole reason that I created my How to Fix Your Hip and Pelvic Pain plan for pregnancy and postpartum, because there's so much that you can do at home in that plan. There's a way to reset your hips, a couple different ways actually to reset your pelvis at home, really similar to what I would do in the office. There's mobility, there's strengthening with reps and sets, and it breaks it down issue by issue, okay? So if you are having round ligament pain, if you're having pubic bone pain, if you're having low back pain, sciatica, I'm going to give you basically a little framework for each one of those issues and then tell you exactly what you can do to strengthen, to mobilize, and to try to fix that problem on your own at home so that you don't have to go in and see someone and spend your time and your money and all that stuff. So if you're having those issues, go ahead, check that out. Obviously, I will link it below for you, and feel free, please, to reach out if you have any questions. I'm always super good about getting back in my DMs. So go ahead and message me on Instagram is a great place to reach me. And again, I just want you to know that you are not broken. Your body is not weak. You're changing, you're adapting, and it's totally normal to have some of these issues pop up, but you don't have to live with them. All right, until next time, ladies, stay strong. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder. Motherhood is athletic, and you're still the athlete you've always been. But it's not about going back. It's about moving forward intentionally and powerfully. If this episode resonated with you, I'd so appreciate it if you'd share it with a friend, leave a quick review, or rate the show. It helps more moms to hear what they need to believe, that every mom is an athlete. See you next time.